Record to the cloud. It's easier. Okay, so we're recording. All right, so thank you, Dr. Mauricio, for taking the time today and doing this so early. I know you have an emergency, so you can just get started. One of the questions we wanted to know for World Health Day is, we know that you're a vegan, and so do you have any tips to share for first-time vegans or anyone interested in starting that journey?
Yeah, thank you. Thank you so much for having me. Well, vegan is such a strong word in the sense that it encompasses more than just your dietary pattern, right? So I guess that the best way to answer this is how to follow a plant-based diet. So I guess, well, nothing changes really because all the worldwide recommendations for a healthy diet recommend whole grains, fruits, veggies, nuts, seeds, legumes. So my best advice is just to make sure you're adding those important aspects to your diet, those important items every single day. Try not to just avoid, not eating animal foods and you're okay with it. That's not how it works. We know from nutritional science that what matters the most is what you eat instead of what you don't eat. So try to eat as many fruits, vegetables, whole grains, legumes, nuts, and seeds as you can. That's my best advice, and that's easy to follow.
Oh, that's great to know. I feel like as someone who's not a vegan, I feel like when people say veganism, I automatically think, oh, I can't eat anything with animal product and like do all that research first. So that's a good tip to know to start off there. We also know that you work in East Harlem, so I'm sure a lot of your patients you see are Hispanic or in the Black community. We're really interested in knowing what are some myths that you love to demyth in the Hispanic community and in the Black community?
Well, there are many, and this is a historical problem. We know that the Black communities, the Hispanic communities, they tend to have these myths, and these myths happen because they are sometimes moved away from the healthcare system. So they don't have sometimes access to reliable information. So I guess the most important myths that we need to bust nowadays is about vaccines. And we we need to make sure that our communities understand that vaccines are efficacious and they're completely safe. And make no mistake, is our most powerful weapon to end the pandemic. So please do not pay attention to whatever you read on Facebook or listen from somebody else. Try to, get your information from reliable sources such as the CDC and the WHO.
That's good to know. I know at the beginning of the pandemic, especially in my community, a lot of I don't know if you've heard this term WhatsApp moms, where they get all their information and they just forward it on WhatsApp and they don't know if it's true or not. Started to share all the like home remedies on like what to fight for COVID. So how do what's your views on home remedies? How do you feel about those?
You hit a hard point. Yeah, WhatsApp is probably the most common source of misinformation in the world. Actually, a friend of mine who is an epidemiologist and a scientist, we created actually a WhatsApp chain to try to counteract the misinformation out there regarding vaccines. It's just incredible how rapidly it spreads. There, unfortunately, are no remedies for COVID. I think the most important remedy is to wash your hands, use masks whenever you can, and try to avoid crowds. So up to this date, we do not have a lot of medications. We saw, for instance, a very famous president in Latin America promoting a herbal remedy. That's terrible because that creates a lot of confusion. And not only it creates confusion, but it gives this very negative narrative where people think, oh my God, they don't want us to know the truth. They don't want us to know that there are efficacious medications out there. And that's not true. And that's unfortunate because we as medical professionals, we have to deal with the poor outcomes of this information. So I would strongly recommend not believing anything that's not coming from the CDC or the WHO. And so far, what we know is that protecting ourselves with hand washing, mask, avoiding crowds, getting the vaccine as soon as possible, and call your doctor if you are not feeling well. That's the best advice we can give so far.
That's great. No, and I completely agree with that. I know, at least for my own mom, she'd send me WhatsApp and I'd be like, I don't know where you read this, but please don't believe this. And so I know you touched a little bit on the vaccines, but I guess if you can expand more on some advice that you're giving your own patients that might have concerns with the vaccine, like what I know a lot of people are opting out of it, but what are some, advice you can give to your own patients or just the community who's kind of like thinking twice whether or not to take it?
It's funny. We've been getting vaccines for the last 7 decades. Like every year, like thousands of kids per week in the United States get vaccines. And it is only now that we have like so many questions regarding vaccines. And it's good in a sense because now it has opened the doors to one of the most secure medications in history of mankind. And so you have to understand that at least 20 to 30% of people in the United States are vaccine hesitant. This, I'm gonna go ahead and say it, probably is not a very popular thought, but I think it's good. Having a healthy skepticism in United States, it's a good thing. It's a sign of a healthy society, a society that asks questions, do research. That is phenomenal. I gotta say that that percentage of people who are hesitant towards vaccines, they become pro-vaccines once they visit their doctors. Once they ask these questions to the doctors, doctors have to, answer those questions, hopefully empathetically, and they take their time to, solve whatever questions they have. That is great to know. However, when questions regarding the safety and efficacy of vaccines arise from severe and dark disinformation, like, pharmaceutical chains wanna keep us sick, or this is coming from the government. That kind of disinformation is very hard to break because it's an emotional based information, and that's why we medical professionals should be out there in social media and everywhere explaining to people that that is not true before that information reached them. So the most important thing is that these COVID-19 vaccines have been extensively tested in randomized controlled trials. That is the gold standard of scientific methodology. We know for a fact in hundreds of thousands of people that this vaccine is safe and efficacious. At the beginning, we didn't know if this vaccine would stop spreading the disease. We didn't know that. We knew that this vaccine would avoid you visiting the hospital and requiring oxygen. Now we know that it does spread infection, which is phenomenal. So we have a vaccine that is safe. It stops symptomatic spread, it stops infections, and it stops severe COVID-19. So this is what I basically focus on when I talk to my patients.
That's great. And I know a lot of people are hesitant, and especially with travel, but for like you said, for decades now, we have to get vaccines to go to certain countries anyway. So it's just kind of like the way that life works. And so I am hoping that more and more people get persuaded to take the vaccine, especially older adults. Now shifting a little bit more to lifestyle and kind of that, what are some kitchen tips you'd like to share with families?
Well, obviously we don't have time to go through like all my tips because I have a lot. After almost 17, 18 years of eating this way, I think that we have to adapt ourselves to the reality of modern life. I think that's the greatest tip I can give you. For instance, I wish I had time to, wake up and do my workout and then sit down at the table and have this nice hearty breakfast. I can't. Why? Because I have to wake up at 5 a.m. I work out at 5:30 a.m. I have to be in the hospital at 6:45 a.m. and I work 12-hour shifts. And that happens a lot during the week. So we have to break this romantic idea that a healthy lifestyle goes with this slow paced life. That train is gone, right? So we have to adapt. I think that one of the best tools we have is just to do smoothies in the morning and just make sure you hit all the important aspects of a healthy diet in that smoothie. Just to give you an example, my smoothie has greens, fruits like strawberries and blueberries or whatever. Uh, it has healthy fats coming from either flax seeds or hemp seeds or walnuts or even almond butter. And it has a source of protein. In my case, it's a vegan protein. But if you don't want to go vegan, you can, add any other source of protein. That's okay. So that way, I ensure that I have fruits, veggies, healthy fats, and a very good source of protein. And, I do it. I get 500, 600 calories just from that smoothie. So it's a hearty breakfast. It's fast. And what is most important, I can do it. It's realistic. I can do it within my time frame.
That's great to know. I do think there's some sort of romanticism or like misconception that you have to use all 24 hours of the day very like productively. So you have to wake up early, exercise, have a healthy breakfast, do your work, like, do everything in just one day. And I think that's true. We have to like be with our reality. And so that's great advice. I personally needed to hear that. um, Also, what seasons or traditions can Hispanic kitchens do without, in your opinion?
I mean, I think fried foods is something that we need to get rid of. I mean, I think that that's one of the kitchen traditions that we can get away with. Why? Because it doesn't remove the taste of the regional flavors. It just adds the crispy thing. So we can replace it with baking, air frying, things of that nature. And then you reduce the calories, you reduce harmful fats, and it's better for everyone.
Yeah, I hear that. Everything is fried in olive oil.
Yes.
Tostones and everything,
Yeah.
chicken. Okay, and then I guess moving a little bit back to COVID, what are some of the most common scenarios you witnessed among Hispanic patients specifically in the last year?
Yeah, it's been tough, obviously, because as you guys remember, the epicenter of the pandemic hit New York first. So back in March 2020, we had no idea what we were dealing with. We had no medications, no vaccines, no trials. We didn't have any guidance as to what to do with these patients. We didn't have any, medical guidance. So we did the best we could. Personally, it was very, very hard to see young people dying. That was probably the worst for me. It created a lot of anxiety, sadness. I experienced depression for like 3 months. It was like tough. Like seeing a 32-year-old guy, previously healthy, married with two kids less than 5 years old, dying was like something you're not so used to it. So I think that was the most difficult experience I had. And that made me realize that I had to go out there, start doing videos. So it's funny because we didn't have any guidance in Latin America back in March 2020, right?
Mhm.
I still remember press releases by some presidents of different Latin American countries stating, guys, we're okay. COVID is not here yet. We're going to be paying attention. And I was on my videos, forget about paying attention. This is a virus. This is not a train or a plane that you can see. It spreads tremendously fast. You won't even know about it. Please, start washing your hands. Try to separate. Try to have social distancing. Be very aware. Doctors, please protect yourself. Blah blah blah. And then boom, everything started. So I think that it was sad in the sense that I saw all this disease and death rolling in front of my eyes, but it also gave me the strength to go out there and warn our Latin American countries. Yeah, that was pretty much it.
No, I feel that. And at least, again, I feel for you, and that must have been very tough. I know for a lot of us staying home, we experienced depression. So I imagine being a frontline worker and experiencing that firsthand. I know, at least for me, I've been very upset the last year when I see people going to like Mexico for vacation in Latin American countries, Puerto Rico, and treating it like their vacation spot, and then coming home and you hear about all these people who actually live in these countries and end up getting COVID because of the vacationers. And it's like people don't like think about it. So it's really sad because they don't have the same privileges as we do, at least in the United States. And so it's like, it's a catch-22. Like, it's like, what can you do? So I feel for you on that. And thank you so much for bringing awareness to, to our communities and for doing that. I have 3 more questions that are COVID related. Sorry, I got a little emotional there because the last year's been tough.
It has.
So now that we're kind of going into some sort of post-COVID world, we're not there yet, but we're hopefully working towards that. How do you recommend we continue to support our essential workers?
Well, the most important thing is the awareness that we are required to have a normal functional society. And also a good thing for the public was to be aware that doctors are human beings, doctor, nurses, techs, they're human beings, and we experience fear. I mean, we're not different than you, and also it also busted a lot of myths surrounding medicine, like how in Hollywood doctors are portrayed as these very cold, nasty human beings, that they don't care, they all care about his money. And that's such a nonsense. And I'm glad people realize that that's just an idea. That's a prototype that people has used for years to sell movies and TV shows, when actually it's not true. We're like human beings. We have the same fears. We have the same feelings. I guess that one of the most difficult things for me was at the beginning of the pandemic, as you know, New York was hit hard. Not all New York though, like certain areas in New York. And one of the things that was like very hard for us in the emergency medicine community is that a very well-known and beloved emergency medicine physician, female, committed suicide. And this doctor didn't have any mental illness history. She was like a normal human being like the rest of us. It was like an ordinary human being going through an extraordinary situation, and that can unfortunately create these events. And that made me realize that we have to rely on each other, like the power of society. And it made me realize that maybe we have to be more honest within ourselves and with our community, like express what's really going on, try to be as transparent as we can. And I think in the post-COVID world, one of the things that I would emphasize continuously is scientific and humane communication has to happen every single day throughout the year. Like, I've seen some incredible mistakes going on in Latin American countries, just with the fact that they have this major scientific breakthrough, but they're not able to communicate it thoroughly. And that's what's happening with vaccines. It's not enough to have vaccines. You have to know how to convince people and communicate that they're healthy and efficacious. And you have seen how different countries struggle differently. So this scientific and humane communication, that's something that we have to pay attention to it. Like how to keep, forming human bonds with our society, with our, community. I think that that's an important part. And I think industries, companies, churches, gyms, they can always pitch in and do something about it, like creating, like tightening their communication within the community.
Thank you. I agree with that. I know at the beginning of the pandemic and throughout the last year, we've put healthcare workers on a pedestal and calls you all heroes, and you are heroes, but I know that kind of takes away kind of a degree of humanism, like kind of like seeing you guys more as like like heroes, like Marvel and like DC, and we're like you guys are above and beyond the feelings. But we know that's not true, and I'm so sorry for your loss. With a doctor from the emergency room. I know it's been very tough for you guys. So I know everyone kind of wants to help in a sense for essential workers moving forward and post COVID, because I know you guys have that like kind of traumatic experience. Again, seeing it from firsthand. And so it's great advice. I do think the community now, as we look to recover, needs to be more together, especially in New York City, since it's always been kind of an individualistic community. We must be more of a strong bonded community. So thank you. And I guess in the same swift of it all, what is the state, or at least that you're seeing, of emergency rooms now? Are you still seeing a very high intake of patients? Is it slowing down?
So the volume is getting back to normal, but with regular patients, thank God. Yeah, regular, normal, everyday emergencies, right? But in New York, so far, we've seen a tremendous reduction of cases. Lately, in the last 2 or 3 weeks, they've noticed like a small peak of cases, like 10% more than usual. We're not exactly sure why this is happening. Some people think that this is the new UK variant making its way into the United States. Well, not making its way, it's already here, but becoming the predominant variant within the community. Some other people think that it's just normal human behavior, like people are getting more relaxed, the weather is beautiful, so so we don't know, but for a fact it's definitely not as crazy as the previous 6-8 months, so thank God for that.
Definitely, thank God for that. That's good. I do joke with my friends that because the weather's getting nicer outside, everyone just forgot about protocols and they just want to go back to normal life. So I do think I agree with that one. It's getting nice, so people want to be outside. And then my last question is more, what yearly check-ins should we be sure to start rescheduling post-pandemic lockdown?
Yeah, so one of the things that is important for the Hispanic and Black communities is that we're more prone to have chronic diseases such as diabetes, hypertension, high cholesterol. So it's very important, especially if you suffer from obesity or you have a strong family history of diabetes, hypertension, heart disease in your family, you need to schedule an appointment, as soon as possible. Like the recommendations vary, but I would say if you're turning 40, for sure, make sure you have a primary care provider. If you're less than 40, but you've been dealing with obesity or, or overweight, or you're not feeling well, please visit your doctor. It's simple, and we can take care of you, and we can, formulate a plan where we can see you every 6 months, a year, just to make sure everything goes according to plan. Do not forget, it's easier to prevent, it's more difficult to treat.
100%. Yeah, I need to start doing my yearly check-ins, so that's very true.
Reminder.
It's a good reminder. Okay, those are all my questions. Thank you so much. You said you had a presentation. Do you want to go through that? I know they're going to cut up some of this. I'm not sure how they're producing it. So I think you have ability to share your screen. So it's sharing the screen. We can go through that, and then I can send them the recording.
I think you have to you disable it because you're the host. So I think you have to go to your settings and just allow share screen.
Okay, I made you a co-host, so see if you're allowed to do it.
Okay.
Again, thank you for sharing your story. I know it's difficult. We're not even a year out, and so thank you so much.
Thank you, my pleasure. Okay, so let me just start. Yeah, everything is in Spanish, but yeah.
Yeah, no worries. Yo lo entiendo. Es que no lo puedo hablar muy bien.
Okay. Okay, so can I say words like guys and things? Can I use those words like guys and blah blah blah? Can I make it like very like casual? Is that okay?
Yeah, that's good.
Okay. Okay, so here we go. Healthy while watching Netflix. How to counteract the pandemic lifestyle. We know that we have suffered this Netflix pandemic too, right? Like we're watching Netflix, we're sitting in the couch all day long, not working out as we used to, and probably eating more than we should and not so healthy foods. I want to say something up front. I'm not judging you. I'm actually telling you that I have suffered from the same. So this is like a patient to patient conversation. Okay. I completely understand what you're going through. I got to say that for the first time in many years, I've been on the patient side. And that was illuminating for me because it made me realize how you always have to be empathetic and you always have to try to put yourselves in the shoes of your patients. So it's funny how life works. I'm a I'm an internal medicine and emergency medicine physician in New York, and I've been living through this pandemic since day one. Like I literally start reading about this atypical pneumonia in China in December 2019. I still remember the day I knew about it, and I've been following all the science behind it um, since day one. And it happened to hit New York first, where I practice medicine. And one of the most important things that I've been doing, well, at least I think that it's an important thing, is trying to prevent disinformation to reach people that have the highest risk of dying from COVID-19. And it has been, it has been exhausting, but it has also been extremely rewarding. I've been doing like videos and Instagram posts and YouTube lives. I've been doing my best to avoid disinformation reaching these people that we need to care for the most. But the funny thing is, life works in very mysterious ways. I've been doing pretty much the same for the last 17 years in the nutrition world. Like, okay, full disclosure, I follow a plant-based lifestyle. Like I eat mostly plants. I don't eat animals. I don't want everybody to go vegan. I do not push everybody to go vegan. I'm a very evidence-based guy in the terms that we know that there are plenty of healthy dietary patterns out there that have science behind it. And I don't push any particular dietary pattern to my patients. I let them decide. Okay. It's always a shared decision making. So, but the thing is, I've been trying to protect my people, my Latin American community, from falling prey of all these nutritional disinformation tactics, like taking this supplement or doing this or doing that, when things do not work that way. So it's pretty funny how life works. I've been like fighting this information in the COVID world, in the hospital, and also on my own social media platforms in terms of nutrition and lifestyle. So moving forward, and just a brief example, this is a summit that we host every year in Mexico City, where we discuss all the science behind nutrition, exercise, and behavioral changes in order to have a better and more robust health. Now, when it comes to a healthy lifestyle, like, oh my God, I'm so stressed. Oh my God, I haven't been eating well. I need to change. And the first thing that comes to mind to all of us, don't lie to me, I know you have that in your mind, is that in order to recover your health, you have to have this perfect setting, right? In the middle, in front of the ocean with perfect weather and a matcha tea next to you and, and a kale smoothie. And you guys know that this is not real, right? That this is, I'm not saying that this is bad. I wish I could be like this woman right now, but I'm not. I'm commuting. I'm dealing with patients. I'm dealing with bills. I'm dealing with normal life stuff. But that doesn't necessarily mean that you have to give in and have a poor lifestyle. You can make changes. I just want to make sure you understand that you don't have to have this in order to be healthy. Okay, we can be healthy from our own perspective, from our own lifestyle. And on top of that, we have Zoom meetings, right? Like with video, you look like, a celebrity. When it's only audio, you look like you're not wearing pants, you're wearing shorts, you haven't shaved, you know. We've all dealt with this. And it's, for some people, it amplifies this feeling that we're not taking care of ourselves. I want to reassure you that you're not alone. And this does not necessarily mean that you're not taking care of yourself. This is just a new lifestyle that we haven't understood perfectly how to adapt to, but we can, and I will show you how. So before we move on, I guess that the main message of this presentation is to understand that we have to return to a normal, practical lifestyle. I call this the return of the reason. So if I have to send one message to you, I want this message to be completely understood and heard. I think without a doubt that one of the most important scientific findings of the last 10 years is that chronic inflammation is probably the underlying etiology of the most common diseases nowadays, especially in the Western Hemisphere. And if we understand, and we do understand, make no mistake, but if we communicate this message to our community, bigger changes can happen. Like big, amazing impacts in our public health can happen for sure. And I want to explain to you what chronic inflammation is and how we can maybe not get rid of it, because that's a very, wishful thinking, but, control it and make it our ally instead of our foe. So I want to understand, I want you to understand what inflammation is. Let's make this a scenario. You hit the gym after 3 months, and then you're doing pull-ups, and then, you pull up a muscle on your shoulder, your left shoulder, and that hurts, right? That is 101 inflammation, right? What happens is this muscle gets stretched more than it's used to, and so it gets inflamed. And what happens is that growth factors start swimming around that damaged muscle, and blood vessels get engorged in order to have more blood and nourish this tissue with oxygen. But that hurts too, right? That is what we call acute inflammation. And the main purpose of acute inflammation is to heal that damaged tissue. And luckily, our bodies work perfectly well to do that. That also happens when you have a cut in your arm, right? Or when you hit your knee. That acute inflammation process, it's a beautiful process that, again, heals the tissue, heals the damaged tissue. But there's another thing called chronic inflammation. In the scientific world, it's called subclinical inflammation. And this inflammation comes from not so obvious reasons, and you most of the time do not feel it, right? It's not like you hit yourself or you get caught. No, you don't feel it, but it's within your body, is within your cells, is messing up with their entire metabolism. And let me show you this from this slide. You can see on the black figures, you can see the things that promote subclinical inflammation. You can see chronic infections like hepatitis B, hepatitis C, HIV. You can see physical inactivity. You can see obesity. You can see dysbiosis, which is like a disruption of the normal healthy gut bacteria You can see diet when you eat a high sugar, high saturated fat, low fiber diet, isolation and chronic stress, right? Disturbed sleep, and xenobiotics, which are like toxic things in the environment that we are exposed to. So as you can see, and this is most important, this is the most important slide, but you can see it's not one thing, right? So when you open these like very trendy blog and, oh, the food that you need to eat to counteract inflammation, and that is just, sorry, BS. That's not true. Why? Because it's not just one thing, it's a complete lifestyle. So that's why it's so important to unite medicine and nutritional science in order to counteract this lifestyle. Like we know for a fact, for instance, that people with HIV, unfortunately, have higher incidence of coronary artery disease. And the reason why is because these chronic infections, they promote inflammation. And this inflammation in 10, 20, 30 years damages a lot of tissues, right? So the same goes with physical inactivity, obesity, dysbiosis, diet. Now you're understanding. It's not one thing. It's our lifestyle. We don't have to go crazy trying to modify perfectly each one of those. You can try to have a very decent, healthy lifestyle, and you can be protected from subclinical inflammation. Now, see the other part. Please focus on the other part of the slide. If you have these things feeding the subclinical inflammation, we end up with metabolic syndrome, type 2 diabetes, fatty liver disease, cardiovascular disease, certain types of cancer, depression, autoimmune diseases. Okay, you can get the gist of it, right? It's not one thing, it's not one single process, it's a whole lifestyle. So this is very important for you to understand that what we need to somehow optimize is not only your diet or your exercise, it's your entire lifestyle. And I cannot emphasize this enough. Now let's move on. So one of the things that will free you from this thought that you have to be perfect is the fact that most of studies have shown that you don't have to do a lot of things to be healthy, right? There are simple, easy things that mortals like you and me can do to make ourselves better and healthier. And I'm a very science-oriented guy. My mind is like a square. If I don't see a number and if I don't see a statistic attached to it, I do not understand it. So hopefully there's a lot of people out there like me. So I'm going to show you with data how basically modifying 5 simple habits can have a tremendous impact in your health span. Okay, this is a study done by Harvard researchers, by Dr. Willett and Dr. who are like, you know, I call them the Robert De Niro of nutritional statistics. You know, if they were actors, they would have at least 8 Oscars. So they did this study where they followed hundreds of thousands, more than 120,000 people over 34 years. Can you imagine that? The amount of wealth from the statistical point of view you can get. So they follow all these women and men over 34 years, and they basically analyze how 5 habits in these people impacted in their mortality. So what were these 5 habits? Healthy weight, exercise at least 30 minutes daily. Come on, 30 minutes, come on, anybody can do it. And the best part about these 30 minutes daily is that we know also with scientific data that you don't have to do 30 minutes in a row. You can actually do exercise snacking. You can do 10 minutes here, 10 minutes there, 10 minutes before going to bed, and it's pretty much the same, which is liberating. You don't have to, dress with Lululemon and go to the gym. You can do it at home, 10 minutes sessions throughout the day, even when you're working with Zoom. you know, moderate alcohol consumption. It's not saying do not drink, it's just drink moderately, which is different, right? Not smoking, unfortunately, this is like literally black and white. You either smoke or you don't, period. So you have to quit smoking. There's just no other way around it. And a healthy diet. And when you hear healthy diet, oh my God, all these thoughts come to mind. Like, I have to be perfect. Oatmeal. I have to eat olives picked, mature from Greece, and things of that nature. Nothing like that. It's basically a decent diet. The way they measure a healthy diet in this study is a diet that at least includes 40% of what a healthy index score diet is, which is like pretty attainable by pretty much everyone. So just to put this in perspective, if you eat a nice fresh salad with vegetable protein coming from nuts, seeds, legumes, tofu, uh, olive oil, that pretty much gets you there. And just one salad, come on, guys. Anybody can do it. We can do it. We can buy it anywhere, right? For some people, it's very hard. And that's another thing that we can talk about it later. Like, there are people, unfortunately, that have no access to healthy foods whatsoever. And that's very important thing to realize, the social determinants of health. It's very easy when you have access to a gym or Whole Foods. Well, for some people, they do not have access. So I think that one of the most important things for activists out there is to help us have these people who otherwise wouldn't have access to healthy foods and spaces for working out. So this is what a normal diet would look like, at least once per day, which I think for most of you should be easy. Now, working out, it can be anywhere, guys. You don't have to have this fancy gym membership. You don't. You don't. You don't. You don't. You don't have to have fancy gear. If you go for a run, quick run, 30 minutes, or if you do push-ups at home and jumping jacks, that's what I do. I mean, I do have access to a gym. I don't go to the gym every day. When I don't go to the gym, I basically do push-ups, pull-ups. I got a pull-up bar on Amazon that was like pretty cheap. And I do jumping jacks before going to the gym. And if I hit my 25, 30 minutes, I'm super happy. I feel great. I feel energized. My energy at work is just phenomenal, right? And that's also realistic. I'm not a professional athlete. I don't want to have a ripped, abdomen. I don't want to have a six pack. I mean, it would be nice if I had it, don't get me wrong, but but you don't have to have that to be healthy. You don't. Okay. Also, drinking, that doesn't mean that you're not gonna drink, like, never, but you have to be smart about it. Like, honestly, just drinking just by pure drinking is probably not a good idea. But if you reserve your drinking with a social, for a social event where you see your family members and your dear friends, you can enjoy it and at the same time stay within the healthy, realm. So try not to eat more than one or two alcoholic drinks per day. I would strongly recommend not drinking more than 3 or 4 times per week, because there are conflicting data. We have data from these studies, but we also have data from academic centers such as the American Institute of Cancer Research that says that probably almost not drinking at all would be even better, in terms of their breast cancer research that they've done. But if you want to be somewhere in the middle, try not to drink more than 2 or 3 times per week, I would say, if you want to keep it like very safe. And if you do drink, try not to drink more than 1 or 2 drinks, per event. That way you keep drinking a little, you don't destroy your social life, and you keep yourself healthy, which is very important. Now, if you do this like very basic lifestyle, attainable by pretty much, a very high percentage of population. So in this study, the people who did these 5 habits, having a healthy weight, working out at least 30 minutes, having a decent diet, drinking moderately, and not smoking, women who did that had a 14-year longer lifespan than female American that did not do these habits. And for men who did this, had 12 more years of life. This is a tremendous reward. That is the difference between walking down the aisle with your daughter and not doing so. This is like a tremendous reward, guys. And you can be, you can be traveling the world. You can be having fun. You can be doing awesome stuff, seeing your sons and daughter growing up, like graduating college, graduating med school, law school, whatever. I mean, it's a big difference in our lives, and it's not that difficult. It's just a matter of shifting your perspective, right? Instead of saying to yourselves that eating burgers and drinking all the time it's fun, try to shift in your thought and just saying to yourself, keep repeating to yourself that being healthy, it's actually fun. And it's not, as I show you, it's not that difficult. All you have to do is adapt these 5 simple habits into your lifestyle. And believe me, your life is not going to change, tremendously from one day to another. We still have our family lives, and you'll see the rewards along the way. And it's better to have this realistic lifestyle because it doesn't, move all your coins at once. You can still enjoy life, family, friends, and at the same time, you'll be protecting yourselves from now on. And hopefully you'll enjoy a more helpful and rewarding life as years go by. So I think that the takeaway message is it's possible, but not easy. But come on, we can deal with it. The pandemic has proved that much. Thank you.
That was great. Thank you so much. I feel motivated. I do.
That's good. That's great.
I related so much, especially the image of having to be perfect on the beach with my chai latte. Thank you so much for this. I am going to get the recording and send it to Chiara and the folks at Ola. Again, I don't know if I introduced myself. I'm Chantal. I work with HPRA, so we're the nonprofit organization they're partnering for this. So I'll send it over to them, and I know they're going to do their editing and include it for tomorrow's event. So I'm sure they'll let you know the next steps after that. But thank you so much. I'm going to stop recording. Yes.